I'm Dr. Desiree D'Angelo. I work at Premier Surgical Network and I am a general and breast surgeon. Skin cancer is an abnormal growth of cells in the skin. There's different types of skin cancers. The two that are the most common are squamous cell carcinoma and basal cell carcinoma. They're typically due to sun exposure and are usually treated with just a small surgical excision or like little biopsy removal. The other type of skin cancer is melanoma, which is an abnormal growth in your melanocytes, which is like the pigmented cells of your skin, and that can be a much more aggressive type of skin cancer. So a lot of skin cancers really don't have any symptoms. Sometimes if you have like the melanoma, like a bad skin cancer, you may present with like an enlarged lymph node somewhere if it has spread. Usually with melanoma, there's changes in a skin lesion where the edges become kind of atypical, or now it's raised where it wasn't raised before. Those can be some of the signs of a dangerous skin lesion. Typically, patients who are at Premier Surgical Network are usually already diagnosed with skin cancer when they come here, usually by their dermatologist, where a dermatologist will do like a small shave biopsy or a punch biopsy to get the diagnosis, and then they're coming to us for a more wide excision where we want to make sure we remove the skin cancer with what we call a negative margin, where there's no cancer touching the edge of the skin of the stuff that we remove. When a patient comes to Premier Surgical Network, whether they have just an abnormal skin lesion that they want someone to look at, or if they already have a diagnosis of skin cancer, typically we'll see the patient first, have a consultation, go over their medical history, and then schedule the excision or the biopsy at a second appointment. Most skin cancers can be excised in the office under just local anesthesia, but sometimes they have to be scheduled in a surgery center where it's a same-day type of procedure where they'll go under some anesthesia to have the skin cancer removed. Recovery from skin cancer surgery is typically very short-lived. A lot of the procedures are done in the office with just local anesthetics, so it's maybe a week of just taking it easy. For larger skin cancers or ones that have to have a wider excision, sometimes it can be a little bit longer. Sometimes there may be additional surgery that's needed to do like a flap for closure or a drain involved. It just kind of depends on the size of the excision. If a patient has a concern for a skin cancer or already a diagnosis of a skin cancer, they can call our office to make an appointment with one of our Premier Surgical Network doctors to have it looked at or to have the surgery planned to have the skin cancer removed.